I am Andrea Leonard, 36-year cancer survivor and president and founder of the Cancer Exercise Training Institute. I want to take a few minutes to talk about working with a client or patient with lung cancer. And while the surgeries can vary from taking a single lobe of the lung to multiple lobes, it's really important to understand what was removed, how much of the lung was removed, because the more that has been removed, the greater the compromise in their cardiorespiratory aerobic capacity. And while the doctors and their medical team will be monitoring them, and along with any damage from radiation or chemotherapy, which can also affect the heart and lungs, I think that as a fitness professional, we need to really monitor our clients subjectively. So we would normally expect to see an improvement from anybody over the course of 2 or 3 months. So let's say you start off and you have your client on a recumbent bike with zero tension and they can barely ride it, with no intensity for a minute. They're out of breath, sweating profusely. You want to record that information. And what we're looking for is to see an improvement over time. So it is completely logical to expect that a month later, 2 months, 3 months later, that person should be able to increase the frequency, the intensity, and or the duration. So while we can't necessarily measure this unless you're in a lab or clinical setting, make sure you are aware of their response to exercise. So that's the first thing. Of course, cardiovascular exercise is going to be critical, but they also, depending on, when they had their surgery, where the incision is, how large of an incision it is, it can also affect their posture. If there is external beam radiation and there's scar tissue or adhesions, that can shorten and constrict across the chest wall, leading to upper cross syndrome and muscle imbalances. So we're going to want to address any range of motion limitations first, and choose specific exercises in whatever planes of motion may be limited: flexion, extension, abduction, internal or external rotation, and then start to choose upper body strength training exercises accordingly. So in the case of upper cross syndrome, we're going to strengthen the back musculature, particularly the upper back, and scapular stabilizers, while stretching through the chest wall and working on deep diaphragmatic breathing. So teaching breathing techniques is going to be key as we work the diaphragm and strengthen that muscle. It is going to help them with their day-to-day breathing as well as during exercise. So taking some time at the end of your exercise session during the cool down, teach them how to do deep belly breathing and really focus on kind of the meditation component of that as well. Try not to do anything too fast. We don't know what their body can tolerate aerobically, or in the event that lymph nodes were removed or irradiated in their chest area, there could be some pooling of lymphatic fluid or, in fact, lymphedema in their torso. And what I would suggest is that you start with whatever amount of cardio they can do, whether it's 1 minute or 5 minutes to begin with. And then I would incorporate both upper and lower extremity lymphatic drainage exercises just to really help improve the functioning of the lymphatic system. Jumping on a mini trampoline or rebounder is amazing. So that could be the warm-up, which will help with the lymphatic flow as well. So this is just a snippet of what you need to know, and there's so much more to work safely, effectively, and confidently with lung cancer patients. I'm thrilled that we are now offering the Cancer Exercise Specialist Advanced Qualification live workshops and online training in Asia. So I hope you will look further into this by visiting ceti.teachable.com.